For more on how the outbreak is impacting essential workers, I'm joined now by Dedrick Asante-Muhammad. He's an economic inequality analyst. Dedrick, thanks so much for joining us. These last few months have been difficult for most people, but for essential workers, that's been amplified. Talk about some of the unique challenges they've faced and continue to face.
Yeah, I think, the framing of essential workers is interesting because previous to that, I would have called them economically marginalized workers, right? These are workers that oftentimes were making, lower income, didn't have strong benefits, didn't even have oftentimes strong security over the amount of hours they got each week. So, I think in many ways it's not that surprising that those who are most economically disenfranchised in the United States are those that are going to suffer the most in a public health crisis, particularly in the context where our healthcare is reliant so much on the insurance we get from our employers. And oftentimes, quote unquote, essential workers do not get that type of health insurance.
There is a racial component sometimes in the people who are holding these types of jobs, these marginalized jobs that you talk about. How have we seen that play out?
Yeah, I mean, clearly in the United States, anytime you're talking about economic disenfranchisement, there's a deep racial component to that, and just as, African Americans have twice the unemployment rate of whites, and they generally have had that for the last 50 years, and Latinos, only make about 60 cents, 65 cents on every dollar that whites make, similar to African Americans. You see that they are more oftentimes in these lower wage jobs, and that has had a big impact on those who are disproportionately getting COVID. Also, too, because particularly African Americans are more likely to be in inner cities, places where it's much more challenging to have social distance. So all of those things have made for a worse outbreak of COVID among these groups. And then there are pre-existing health conditions that, again, the economically marginalized in this country are most likely to have the worst type of health condition. So it makes us much more vulnerable to the effects of the disease, and we're much more vulnerable to getting it.
Who falls under the category of essential workers? Many people would think it would be medical staff from doctors all the way down. There are, of course, the delivery people bringing you mail packages. What is the full classification?
Yeah, well, and I don't know, who technically has made the essential definition for essential workers. But what is clear, and I think most of us are understanding, is that the grocery store clerk who might only make $8 an hour, who is stocking the shelves, that is an essential worker, because without that, we would not get food. Even in the medical situations, yes, there are, some high-paying essential worker jobs, like a doctor or a surgeon. Most of the people we interact with at the hospital are not high-paying jobs, but are nurses, RNs, lower level staff, those who even clean the hospital are absolutely essential if we want these services to be provided well. So I think, it has been helpful in understanding that low wage workers are really much more essential workers than many of us who can telecommute from our offices, that the people who are on the ground doing work are much more needed to keep society going.